Okay, very good. I would like to say good morning, good afternoon to our participants. It's very glad to see many people joining. I don't know how many people are online now, but I'm very happy to be invited to give a talk at this webinar on occasion of the World Zoonoses Day 2020. This is very relevant topic in our context because first of all, I would like to say that we are from Southeast Asia where we have a lot of problems linked to zoonotic disease. That's why we need to study it and manage it. But also because I'm working for ILRI at the moment, International Livestock Research Institute. And actually last night, ILRI together with UN NEP, UN Environmental Program, launched a very important report on zoonotic disease and the environment. And since this morning, we had a lot of news and media coverage on this report. I will come back a bit to that. So you see that we are here because of the Zoonotic Disease Day, and many activities are happening at the moment. And in this next 30 minutes or so, I will present about our activities with partners in Southeast Asia on One Health work in the areas of NTD, zoonosis, and EID in Southeast Asia. So I am talking on behalf of my group. So you can see many names here, and some of them are familiar to the One Health community that you might know. So I will talk a bit about the ILRI as institution, but it's very shortly. Followed by a research portfolio on topics that we discussed today. And because I'm currently based in Viet Nam, I will give some information about the COVID-19 situation and the management of Vietnam, because Vietnam is one of the countries that are perceived as well managing this disease, and some conclusion. So first of all, for those who are not familiar with this CGS system, CGS, as you can see the logo here on the top, on the right corner, that is the consortium of agriculture international research, including 15 research institute. So we covering from livestock like ILRI, but also ILRI on rice in Philippines, on sweet potato, on agroforestry, on water ecosystem, on food policy, on genetics, tropical agriculture, etc. So we have really 15 centers, and we work on to improve the food and nutrition security, reduce poverty, and of course improve the environment and the ecosystems. And specifically for our ILRI, we work to improve people's life through a better livestock. So that is basically the purpose of the institute. And why livestock is important? Because when you look at the growth in demand for livestock product by 2030, here based on several models, etc., of college at ILRI and as institute, you can see here beef, pork, poultry, milk, commodity, everything is rising in different continents. And of course, it's not because of the overconsumption alone. Overconsumption happened in some of the countries in developed world, but when you look at the Africa continent or Asia continent, the consumption of animal source food is very limited. For example, here the data in South Africa is about 10 kilograms of kilogram per capita of meat only, compared to 70 kilograms of the OECD countries. So you see the need is there, and the growth of livestock production and consumption is very real. And to respond to that, ILRI will work on various programs to address this need of the people, but also find the solutions for the food and nutrition security to reduce the poverty and environmental pressure. We have different programs you can see here, ranging from animal and human health. Animal and human health is basically One Health program at ILRI, where I'm working for. But you have also, the genetics to improve different breed and productivity, feed and forage. We have also a big ILRI hub as a center of bioscience for East Africa, in Nairobi. We have a program on environment and livestock, but also more and more we bring our research evidence into the policy. That's why you have the policy livelihood program, and put it in the practice through the impact and scale. Looking more on the intervention side, and we do it through capacity development, communication, and also knowledge management in different sectors. So our headquarters is in Kenya, in Nairobi, but we have also the office in Addis Ababa, in Ethiopia, and we have several regional and country office. For example, here I'm sitting here in Hanoi office, acting up East and Southeast Asia regional office here. Okay, so that is about the institute I'm working on, and actually the challenge we have. Why we have the office here? Because you know that Southeast Asia, it is a very large region with a lot of activities, fast economic growth. But we have also the issue of complex health linked to different types of infectious disease, antimicrobial resistance, but also facing the so-called transition in epidemiology with non-communicable disease is also raising up. So the bottom line is, in fact, we need the capacity building for different level for people, institutional level, to address this health problem, in particular emerging infectious disease and zoonotic disease, by looking also at the cultural development and environmental consideration. So we are working with various partners in the region. I'm very happy to give you talk because Professor Wayan is also one of the very dear colleague and friend of long that with ILRI. We have been working together for more than 10 years now in a so-called One Health and Ecohealth program, EcoZ, and Gajah Mada University was one of the key partners in this program. We looked at how to use eco-health approach, and for those who know One Health, eco-health is very similar approach, but actually we look at health in a broader context of socio-ecological ecosystems context of health. So for that we partners with different countries. That project linked with 5 countries, including in Indonesia, Viet Nam, Laos, Cambodia, Thailand, and China, mainly working with Kunming. And with the funding from IDRC, we could conduct study on zoonotic disease at that time, but in particular, BINUP Ecohealth Resource Center in Gajah Mada University and Chiang Mai University. And now we can say that the One Health Center who is organizing this seminar is kind of linked very much to the foundation of that Ecohealth Resource Center. So ILRI here, as and in this figure, we are not working alone, but really working in partnership with different institutions in the region and in the country level. So that is actually that's the kind of starting point of the eco-health that we work in the region. Before that, we have avian influenza work. But now I would like to show you a bit what are the ongoing projects we are having. So we are working, for example, here the mosquito in urban environment project funded by Sweden, try to looking at the urban context linked to the livestock and how the interaction between livestock and human have linkage with zoonotic disease in Hanoi, because in some of the country, urban livestock keeping is still an important activity because it contributes very much to the nutrition and food security, but also it provides the human urban inhabitant with livelihood option for people in that kind of context. If you look at some of the photo, like I believe it was taken from India, very often you see this thing, or even here in Hanoi and some other city in Vietnam or Cambodia or Laos, the urban livestock are quite prominent in some of this part. And actually here the studies are in Hanoi city, even the capital, we have a lot of animals, 160,000 cattle, 1.6 million pigs. I believe that this number please reduce a bit now because of African swine fever happening from last year, and 23 million poultry. And we had actually in the history of Hanoi quite an important outbreak of dengue fever, in particular the peak we had in 2017 with 28,000 cases, but also Japanese encephalitis virus also occur in the city. We didn't see Zika virus yet until now. And for this project, we have different groups. For example, here a master student project looking at the urban livestock keeping and dengue in urban and peri-urban Hanoi. We conducted it 2 years ago, and we could not see any indication of the household keeping livestock linked with the higher risk of dengue virus in Hanoi during the season of lowest occurrence of dengue. But it clearly shows that the need for more information provided to urban inhabitants, particular to personal protection, because Hanoi is a big city, many migrants coming here for work, but also we have a lot of young people, in particular students. They are living in a kind of a vulnerable environment, and that information provision is really needed for doing more communication from this kind of study. We have also people looking at the distribution of mosquitoes linked to the flavivirus, dengue, Japanese encephalitis, and Zika present in different urban mosquitoes, as a relationship with livestock keeping, but also going more on the understanding of the risk factor analysis with mosquito-borne virus, looking at the people and patients at the hospital. And of course, we go more on the intervention package with these people. So you see, the One Health here is really looking with we are collaborating with people from animal health sector, who is the National Institute of Veterinary Research in Viet Nam. But we have to look also with public health side and medical side, in particular people from hospital and school of public health, to look at the problem in urban environment linking to livestock. Some photos showing the activities of this One Health project by face-to-face interview. So a lot of community work, talking with people from different districts here, but also a mosquito trapping with our colleague from National Institute of Hygiene and Epidemiology and Vet Institute, and also taking blood from dogs and pigs, and also people in different settings. We have a PhD student working on that, and Nguyen and colleagues, I would like to emphasize that the PhD student in this photo here, he actually is an alumni of UGM, Gajah Mada University One Health program. Mr. Thang now, he was actually our student from Hanoi School of Public Health and moving now to ILRI to conduct his PhD research with Swedish University, Uppsala. But he had a very solid background in One Health and public health, with the training from Vietnam and Indonesia. So we are very happy to have him on board. And of course, he actually do a lot of molecular work with Vietnam and Uppsala University, both in human and in animals. So basically, that is an ongoing project. We look at different types of virus in mosquito presence linked to the livestock and disease in hospital and in the community to inform people from the community, but also health and animal health authority. In addition to that, we need to think also how to develop tools that allow people from these sectors to work together and to detect disease in an early way. So for that was actually the topic of the CCAPS project at CGS on the surveillance and early warning system for climate sensitive disease in Vietnam. And that was also a collaboration between Vietnamese institution and ILRI, and also some CGS center, in particular the CCAPS and Agriculture for Nutrition and Health, A4NH program. The concept is actually not very new, but actually we want to use existing data, because in the country like Vietnam, you have a lot of climate data managed by the Ministry of Environment and Nature Resource Management. You have data on health surveillance from Ministry of Health, and you have animal health data from Ministry of Agriculture and Rural Development. So the question is, in fact, how to identify the way really to bring this existing data together to make the case on the relationship, on the linkage between animal health, human health, and in the environment. But for the group of specific diseases that are sensitive to the climate, because that is the topic, as is the scope of the study. But more importantly, developing tools to support the decision making to manage health of people and animals. And from this tool, hopefully that can provide information for people to respond in terms of prevention or control, like vaccination, movement control, and quarantine of people and animals. So that is actually the framework of the project. And for that, we look at the secondary data, but we also look at the new data by taking samples from different provinces in Vietnam, in 6 provinces representing 6 ecological zones in Vietnam, in pigs, but also in maize, because we work on aflatoxins, these kind of toxins produced by fungus, and working with national partners from really 3 ministries: health, environment, and agriculture, and national partners. And from the secondary data, we could create kind of the risk map, to really identify the whole scope of different infectious diseases based on the animal and human health surveillance data. So for that, one of the take-home message here for you, I know that you are mainly from Asia, but I saw that colleagues, you are also connected from Africa and some other country. You really need to develop a very good relationship and partnership with the local authorities from really different levels. Because when you talk about One Health, it's not about the top level, but ministries that we talked about the theory and framework, etc. But we really need to work also with the local people, where actually you have the problem of health, of human and of environment, and eventually the environment. So for that, we collected data from the Ministry of Health, so you have to have a good relationship with the ministries, and you work with scientists to do analysis. And of course, you can always question the quality of the this kind of animal health and human health data surveillance system. But actually, this is the best information you have in the country, and you need really to collaborate with the military to do this kind of thing. And for that, you can produce risk map. You can identify what are the best moments to vaccinate or to present the control measure to reduce the viral encephalitis in the country. Actually, we didn't really have the Japanese encephalitis data from the Ministry of Health, but studies showing that Japanese encephalitis are part of the viral encephalitis that was monitored by the country. So that is actually a good proxy to show what are the areas when at the moment to control it. For example, here in Vietnam, most of the case happening in July, August, September, for example. We work also on rabies data analysis to see the patterns of seasonality in the country. Here, for example, we look at the Mekong River Delta and Southeast Central Coast region, all the way linked to the concept of ecological zones, because that actually influence very much on the culture of people, but also the lifestyle, etc. That's why this research and the intervention also need to really target on this thing, because some of the introduction of intervention, if it is not really considered from social, economics, and cultural perspectives, that actually you have a very low chance to be successful in this type of research. Or here, for example, we look at the dengue fever again, but here really looking at a very long duration of 12 years from 2001 and 2012 by developing a statistical model for forecasting risk linking with environment data from Ministry of Environment, but also from different types of data extracted from satellites. That work was led by our colleague Bernabette from Nairobi, and we published it recently. And you can see actually different kind of inter-annual trends in dengue incidents in Viet Nam, coupled with the environment data like temperature and rainfall. That data was also from Ministry of Environment, and actually from that you can develop kind of model to predict where would be the place you need to pay more attention in terms of prevention and control. And actually we are developing a kind of real-time online forecasting system where they capture information from both from the country but also from a satellite system linking with temperature and humidity and rainfall, etc., to have information about forecasting of disease for Vietnam. So you see that basically the tools in terms of forecasting, in terms of recognizing the hotspot where we have to target. Of course, we don't neglect the areas that we need really to search for the pathogens, because that is linking to the very core component of surveillance. We need to catch the virus, the parasites, the bacteria. And one of the studies we developed with colleague from Duke University and National Institute of Veterinary Research here is to look at how virus in live bird market in Hanoi and other border province with China can be monitored using the bioaerosol sampling, the air sampling facility, because that can avoid the invasive sampling, and it's good also for animal health and animal welfare. So for that we actually use the air sampler from the US, and actually we put this kind of sampler to sample the air in live bird market or in the pig farm, you see, and also next to kind of farm workers to screen the virus, and it shows that we have kind of quite good compliance alignment between the virus from the swab carcass in the animals and the virus coming from the air samplers. And if you think of using this type of facility to do the monitoring and surveillance system in a live bird market or in the poultry farm or the pig farm, so that would be a good way to do. And now we talk about COVID, but any type of virus and even bacteria might be eligible to use this kind of technology for that. And again, you can see here that is we apply an One Health approach, because we took samples from animals, but also from farm workers and live bird market traders to analyze virus from the both sides to see how it circulate. And now we are working on a new program. Since we have H7N9 from China, we target really is the border country with China, and here you can see in red color from Lao Cai, Lap Sơn, and Quang Ninh in the north of Vietnam, where we had a lot of intensive contact with China to monitor this different type of virus in pigs and poultry and human. So that was a little bit sampling and lab analysis. Now I would end with some other example on the foodborne diseases. And if I have time, I can touch a bit on antimicrobial resistance. But actually, the food safety, it has recently become a very increasing important issue in development discussion, because recently ILRI worked to generate evidence to show food safety impacting on the poor people. One of the report of WHO and FAO published 2 or 3 years ago showing that the burden of foodborne disease is equivalent with the top 3 diseases of HIV/AIDS, TB, and malaria. And also economic, this means that about 600 million in this every year, and 420,000 deaths per year because due to foodborne disease. And also looking at the economic impact, that costs a lot of money at global level, about more than 100 billion US dollar, and most of the things attributed to the loss of productivity and malnutrition in different countries. That's why, looking at the risk of foodborne disease in particularly in developing country or in informal market are important. And here we apply the risk-based approach to look at the risk at the slaughterhouse at production level, and it's the market, but also of the consumption level. And by doing so, you have an idea about how many people got sick, and you could advise on the specific intervention. And some of this data could be written up, and it reached the government communication level, and some of this evidence was taken up by the donor, like the World Bank or the Vietnamese government, to develop large project of food safety intervention. So bringing really the One Health work from research level into the implementation and changing the intervention and policy is also very important. Or we are doing similar things in Cambodia, where we look at the pork and poultry risk in the wet and traditional market, and now we look at the health risk and converting it in economics. How many dollar, for example, here $60 to treat one foodborne disease case in Cambodia, and you can have an idea about economic loss, and that will help for the intervention in the wet market, but also in different type of slaughterhouse and the farm for tropical regulated disease. Here we work on cystiticosis and trichinosis. We colleague from Germany, from Free Berlin University and BFR. In really a different countries, we use a regional office to look at this risk in Vietnam, Laos, and Cambodia, where always looking at the One Health approach, sampling human, animals, and the environment. And here we have a project funded by Australia and DMZ from Germany. So the capacity building component of each of these projects are also important, like for example here for the parasite project on minority people in Laos and in Vietnam benefited a lot from this kind of training for meat inspector, but also we had intervention for the community through very simple hygiene practices, but also talking with local authority and health management. Here I just show some early data from parasite in pigs and human, but the important thing is really to engaging decision making, public health people, scientists, veterinary medicine people, and the community together. And actually here is one nice example of One Health we had in Laos when we conducted this One Health study through Come Across project, and now under ILRI funded project at the moment. Or here, I said that ILRI is based in Africa. That's why we have also more. We have much more work there. But in the context today, I talk more about Southeast Asia. But one of the example we often cite on how to apply One Health in the real context in Africa. Here's, for example, the study of Bernard Bat again on Rift Valley fever. Also a viral zoonotic disease, mainly affecting cattle, sheep, goat, and camel. And actually, we come up with the risk map and we inform the vaccination campaign and strategy in different countries. And Kenya and some other Eastern African countries are taking up this to conduct vaccination to optimize the disease control in their country. Time is running up. I'm aware of that, but I would like to come back to this report I mentioned from the beginning. If you are interested, you can now freely download the UNEP ILRI report that was launched last night on preventing the next pandemic, zoonotic disease, and how to break the chains of transmission. The key message there is, One Health is not something very new, but actually people really need to open and use this as an optional method for preventing and responding to this kind of outbreak and disease. But more importantly, from research side, as we are doing research, we need to continue producing evidence-based scientific assessment through active surveillance system, for example. And that's why all these tools I mentioned before could be very useful for surveillance system. And also the really raise the awareness and improve health governance, and that linked to the policy and policy implication and working with policymakers in different countries. As examples, we just developed a new One Health Center at ILRI in Africa, funded by BMZ, and for that we will work on zoonotic disease, EID, food safety, and AMR, and we really focus on the field practitioner people working on One Health and linking with research and policy making work to control disease. And I will finish now. I have 2 more slides, I think, 2 or 3 more slides to talk about the COVID working in ILRI. So for that, we have the One Health Center, but we recently had funding from BMZ from Germany to help Ministry of Health of Kenya to test the COVID-19 samples in Kenya. And you see, we are from Animal Health Institute, basically, ILRI, but now we are working with public health people to analyze coronavirus samples in Kenya, and that shows also how One Health works. And at CGL level, we developed the CGL COVID hubs with different institutions like London School of Hygiene, Tropical Medicine, and Institute of Food Policy Research Institute to work on in responding to this crisis. So here, COVID is everywhere now, but in Viet Nam, we are quite happy because we have a very limited case. As of today, we have 369 cases, no death after 5 months here, and actually we are very happy to this control. And actually, the reason for that, I would like to share with you that, of course, we have, and here some of the colleagues made a lot of synthesis and published in different journals. And Vietnam they have a very early success story in controlling COVID-19, and we are not sure what would happen in future. But until now, the reason for that is actually we have a very good commitment from the government, and with the sectoral collaboration approach really work for COVID-19 here, because different sectors had a very timely, accurate, and transparent risk communication, and also have a very active surveillance and incentive isolation of patient, and tracing the contact to isolate them in different settings, in hospital, in the isolation group, and a lot of testing, but also lockdown for some time when needed, and now we are open again. Or another perspective, we had really a fast learning from other countries like China. We learned from China, and also we have a Swiss decision action to lock down or to ban different things. Strong system response, but also consistent and truthful message. And in particular, during the COVID time, we had very good social solidarity in people. To conclude, I think that the research with partners on NTD, zoonotic disease, EID, food safety, help advancing the science and the capacity building for partners, in particular our partners here in Southeast Asia, where we are working in the region. But also, the research translation in this area, sometimes we were successful, like the example of food safety I showed before, or the COVID-19 at the government level. But also, we need to think more how to do more evidence and information, generate more information from the available data, but need to really translate them into action to have more impact. And this translating into action is quite limited, not only here, but in many places of our world. More decision support tool needed. We develop things, but we need to do more. And in particular, always we have to engage policymakers and stakeholders. It's a process. Finally, we need to maintain the network of One Health and Ecohealth in the region, because this region has started a lot of work and have a lot of materials to do it, because we have a lot of health issue here. But also broaden the health perspective to link it with the environment issue and the development, because when we talk about One Health and Ecohealth, it's still too much focus on human and animal. Of course, that is the core things of the One Health, but we really include the environment issue. And that was the proof that we learned the report yesterday. But also more and more, we need to work more on environment, because the wildlife interaction, but also of environmental pollution that lead to the emergence of different disease and transmission of zoonotic disease. So with that, I would like to thank you very much for the attention, and I'm happy to take questions after our next speakers, our two next speakers. Thank you very much.